More unhappy. You need to get out of a funk? Then do this. It's very simple. Ready? Help somebody else. That's it.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
All right, thank you. It is 11:21, and I know that our next guest has some listeners out there who are anxious to hear about this condition where you can't straighten your fingers. And the reason for that is because we've been mentioning it for a day and a half, I guess. Dr. Sidney M. Jacoby is on the phone. He's the Associate Professor of Orthopedic Surgery at Thomas Jefferson University Hospital. He's the Chief of Hand Surgery at Phoenixville Hospital in Pennsylvania and a Medical Director of the Limerick Surgery Center, or is it, yeah, Limerick in Pennsylvania. The initial signs and symptoms of Dupuytren's contracture, which I'm probably mispronouncing, and it is, simply put, a condition where you can't straighten your fingers. Good morning, Dr. Jacoby.
Morning to you. Thank you so much for having me.
Thank you. So did I pronounce it right?
You know what? It's a difficult French term, and you were spot on. It's Dupuytren's disease, Dupuytren's contracture, and you're exactly right. This is a condition in the hand where you get this abnormal thickening in the tissue in our palm. And it basically, over time, can cause the fingers to curl down and the inability to fully extend. And what's interesting about this condition is it's been around for a long time, but it's often been confused with other problems, such as arthritis, a condition called trigger finger, in which the fingers literally click or lock. But Dupuytren's disease is a separate entity in which this tissue in the palm becomes thick. And as I said, it becomes very difficult to extend the fingers. And the way people sort of manifest this or realize that it's a problem is, they have a hard time putting their hands in their pockets, or for gentlemen, when they're shaving or grooming, they poke themselves in their eye because their fingers are curled down.
Right.
It's one of those things that unless there's an awareness and people such as yourself that talk about it, that sometimes go by the wayside. But what's really exciting is that there are really effective treatment options.
Does it come on slowly? Do the people who have this first find themselves unable to straighten their fingers, and then they get it, and then later on they can't get it? It never straightens out? I mean, is it a slowly progressing thing?
Yeah, it's exactly right. And it's got this, what we call insidious onset. It gets to a point where it finally becomes onerous. And so over time it gets a little worse, and then people will say, you know what, it's just over a certain amount of time, I just realized that I couldn't do the things I like. Other examples are, for example, gentlemen who enjoy racket or club sports such as golf, they have a hard time wrapping their hands around the golf club or manipulating fine objects. And so it does progress over time, absolutely.
So this would, a musician, this would devastate a musician or anybody who has to have that dexterity involved with what they're doing, right?
Absolutely. In fact, I have some younger patients, it usually affects individuals when they hit their 50s and 60s. However, musicians are really, forgive the pun, in tune with their bodies. And so if there's a subtle disease in their hand, they're usually all over it. And in fact, a historical note, in the 1920s, the most common hand surgery performed in the United States was a release of some of the tissue in our hands so you can get an extra octave playing the piano. And so people would literally have an elective surgery to release their interossei muscle so they could spread their hands and get an extra octave.
That's huge.
We've come a long way.
Wow.
But musicians in general, and athletes, and artists are really sensitive to small deformities in the hand that prevent them from performing at a masterful level.
I know that it's a very brief interview, so I want to make sure that the listeners know how to get more information. I wanted to ask you, though, about the whatever is happening in the palm that causes this. Could that also happen in other parts of the body, but it's just that the hand is so intricate? Like, could it happen in your arm, but you wouldn't notice it or something?
Yes, it can happen not only in the palm, but also in the soles of our feet. And we call that Lederhose's disease. In the palm, as I mentioned, we call it Dupuytren's disease. And in some gentlemen, it can affect the genitals and the penis, and there's a curvature, and there's also an awareness of that disease that's called Peyronie's. And so the palm, the soles of your feet, and in certain individuals on the penis.
Oh, my.
Yeah, and, it's one of those things where, for some people it can be somewhat embarrassing, but we found that this sort of self-awareness and understanding about the disease process is critical. And then the next step is how do we treat it? And there are eminently treatable options,
Yeah, how do you treat it?
And just briefly to talk about the treatment options, surgery has always been a mainstay, and so whether you make small incisions in the palm or larger incisions to remove the diseased tissue, that's very effective. But what we found very exciting over the past few years is a sort of biologic solution to this problem. It's an enzyme called Xiaflex, Xiaflex, in which an enzyme is injected into the diseased tissue, and then over 1 to 2 days later, the individual comes back to their hand surgeon, and the cord or the diseased tissue, in a very controlled way, is ruptured, and there's often a pop, and in many cases, a very satisfactory result.
Oh, wow.
Yeah.
Wow,
so
how did they
in
figure
addition
that
to
out?
surgery and the injection, the other thing that I want to just briefly mention is there's a needling procedure that's also very common. It's called needle aponeurotomy, just as an option for your listeners to be aware of. So surgery, the needling, and the enzyme are the three options to treat it.
If a person has had their hand broken and then they have those pins put in it and it seems normal now, are they at risk to have this contracture?
Yes, and it's a great point. What we've seen is people that have a genetic predisposition, and that's the main cause of this disease. There's a genetic predisposition, so 3 to 4% of the world's population is hardwired for it. It's in your DNA. However, trauma, including surgery, such as the kind you mentioned, whether you have a fracture and you require pins, or other common procedures like a carpal tunnel release or trigger finger release, these conditions and surgeries can unmask the Dupuytren's disease and sort of wake up a sleeping giant, if you will. And I'll often see patients who saw either myself or someone else, and they'll say, you know what, I had surgery, now I have all these lumps in my hand, and I can't extend my fingers. And it's a discussion that I have fairly commonly.
Oh, really? And do other lifestyle choices affect it? I mean, you hear so much about smoking and drinking and other things. And now I have a part to it. I'll let you answer that one first.
Sure. That's a great point. There are some environmental cues, and so you hit the nail on the head with that as well. Smoking, people who imbibe too much, some alcoholics, and also occupational hazards. For example, people that work with high vibratory equipment, such as heavy machine operators. Again, that can sort of flare up this underlying predisposition. The main cue is the genetics. However, these sort of life choices can also exacerbate it.
Real quick thing about me. I play an accordion. When I was a kid, I played the accordion, and I hadn't played the accordion in years and years and years and years. And last November, for some reason, I had the desire to do it again. I'm 59, just so you know. So a long time passed between the time I last picked one up and last year. When I first started, the left hand, all those buttons on the left hand of an accordion? Mm-hmm. I had an episode where my hand felt like it was like partially paralyzed. And it was like, oh my God, what's happened? I'm 59. Maybe I shouldn't have picked it up again. But guess what? The playing of it actually worked it out and actually helped me. I guess the playing was therapeutic, and it doesn't happen anymore. So I'm guessing I didn't have that.
It sounds like you probably did not. That could have been, a nerve-related thing. Perhaps you were deconditioned. If you hadn't done it for many years, you activate, as you know, working with the accordion. There's maneuvers and manipulation of your fingers that are very unique to that instrument, and so you may have sort of irritated your forearm muscles in your hand. And the second part of that is you're exactly right. Many times the things we do in life are therapeutic. And so once you got over that initial discomfort, I'm really pleased to hear that you improved just with playing. It's great.
Is this hereditary?
Yes, absolutely. So the condition is what we call autosomal dominant, meaning if you have it, your offspring will have it. It's just a matter of how much it's expressed.
Oh,
so
wow.
just because it's in your DNA than your child's, they might not get a terrible disease, but it's passed on from one generation to the next. Absolutely.
So am I right in assuming that there are people right now possibly listening, because I know we had some calls when they knew this was the topic, that might think that they have like arthritis or something else, and in fact it could be Dupuytren's, what is it called again?
I would almost guarantee it, as we sit and you're in Central Florida, that there are numerous listeners that have it in their genetics, and that if they were to look down at their palms, would see that there's some degree of thickening or lumps and bumps that would be consistent with Dupuytren's.
Everybody's looking at their hand right now.
Yeah,
I'm looking at my
I
hand.
am.
Yeah, right.
Okay, and now if we rub our palm, can we feel a lump, like a little marble or something, a little pea?
Absolutely, yeah. And so
Really?
you guys can have some fun in the station. You can take turns, checking each other's palms out. So,
There you go.
yeah, but there's also a very simple test. If you were to try to lay your hand flat on the table, we call it the tabletop test.
Okay, all right.
We try to keep things simple. If you can lay your hand flat on the table, that means that even if you have it, it should not really affect your life as far as daily activity sort of things. But if you can't lay your fingers and palm flat on the table, that's a really good sort of initial test that you might have some diseased tissue that is causing a contracture.
Okay, so we all just did the test and we passed.
Yes, we
Tabletop
did.
test, and you passed.
That's good.
Yeah.
So now the next question would be probably the most important, because everybody who's been paying attention wants to know how to get a hold of you.
I'd be happy to come down and see everybody there because I'm calling from Philadelphia, and like my snowbird cousins and relatives, I'd love to come down and meet you guys. But there are tremendous hand surgeons I know in your area, and so either I would see a trusted internist or family medicine physician, and if there are, and I'm sure there are some really qualified local hand surgeons, I would absolutely recommend that they contact them for consultation.
Okay. Now, if let's say the person is listening and they're just having a hard time remembering this name, is there a website they can go to tell their doctor about and say, look, I was listening to Dr. Jacoby on the radio, and I think I might have what he was talking about?
Yes. There are a couple websites that I think are really effective that would be great for your listeners. The first is from the Dupuytren's Foundation, and it's Dupuytren's, DUPUYTRENS.org. And the second is, we didn't talk too much about it, but this new enzyme called Xiaflex has been shown to have really promising early results. And that's the enzyme where you inject it, and then a few days later, the diseased tissue is literally manipulated in the physician's office, and it corrects the contracture. And that website is Xiaflex, Xiaflex.com. And so I think if you were to, if your listeners were to see their internists or hand surgeons and ask to learn about Xiaflex and talk more about Dupuytren's, that would serve them well.
All right. We will make sure we put those two websites on our Facebook page and on our guest list page. For the listeners, if you can't get online and you'd like to call us to have us repeat to you what we've just said, the name of the contracture or the websites, we'll be glad to do that for you. It's Xiaflex.com and Dupuytren's.com. Xiaflex.com is the Xiaflex one, and DUPUYTRENS.org is the other one.
You got it.
Doctor, thank you so much. This is you don't realize how many people were calling to ask about this when we promoted it. So obviously you're hitting some people right where they wanted to hear it. So it's a good topic.
Oh, I certainly hope so. And our best to you and to your listeners. And anytime, it's a great pleasure.
Thank you. Is it cold in Philly?
Today it's not bad, but that said, I wish I was down with you and Ocala.
Okay. Well, thank you so much. We will take a little break. Be right back.
Today in Florida Ag News on the Southeast AgNet, well, just a note that the November 8th crop production report to be released next week will include information originally scheduled for release back in October when the crop reports were canceled due to the government